Hello and welcome to this week's episode of Ask Dr. Jessica. I am thrilled for this week's guest. I have my dear old friend, Dr. Matt Zerden. He's an OBGYN in North Carolina, and we're going to talk today about different methods of contraception. How are you, Dr. Zerden?
I'm doing great. Happy to be here.
So before we get into our discussion, I just quickly wanted to tell everybody listening a story about you and how much I've appreciated you for so many years as a friend. So you can understand how wonderful of a man Dr. Zerden is. So when I went to medical school, I was living in Boston. I'll make the story quick, I promise. But I moved there in the summer, and it was a really humid time of year. And I lived in an apartment that was on the fourth story with no elevator. And it was so humid, I had no car. And Matt and his lovely wife, Lisa, were my only friends in Boston. And Matt took me with his wife in his car to Target, helped me purchase a air conditioning unit because I didn't have air conditioning in my apartment, drove me back to my apartment. He walked up 4 flights of stairs with a very heavy air conditioning unit, and he installed it in my apartment. And I will tell you, from that day on, he's been a hero in my eyes. So just wanted to remind you of that story. Do you even remember doing that?
I have vague memories of. I remember your nice apartment in Boston, and I remember humid days, and it's hard to be up there without central air. So it's the least I could do.
Well, I'm eternally grateful, so thank you so much. All right, so Matt is a very accomplished OBGYN, and I thought we would talk today about contraception. I know a lot of parents don't know how to start that conversation with their teenagers especially. I thought we would go through the different types of contraception that are out there and how parents should sort of think about this topic. So first, tell us what you do.
Sure. So I'm as I said, OBGYN, and I work in central North Carolina in the Triangle area, and I take care of deliveries and labor and delivery and gynecologic emergencies in a hospital. And then I'm also the associate medical director of a Planned Parenthood in my region and do a lot of sexual and reproductive health care through them.
Where I work, I feel like most families think about birth control pills as the first go-to. That seems to be the most common question that comes up. Starting birth control pills and question about birth control pills. And I know there's a lot of other options that exist.
Well, let me just, let's take one quick step back, and that I know this is a hard topic often for parents and adolescents to talk about, but if you can't talk about it with your healthcare provider, then it can set up for a bad situation. So just some background statistics. I think you shared with me this before we started that approximately a quarter of all pregnancies in the United States are among U.S. teens. And then we've got very good data to say that about 40% of teenagers at some point are having sex, and many aren't contracepting with safe, reliable methods. So I think just realizing for parents out there that it's probably is happening or it's going to happen, and you need to ask about it and make sure to create the space to talk about it with your provider. If you just ask people in general what do people use, birth control pills are often what comes to mind. But it's important to be aware that the American Academy of Pediatrics, which is my resource when I'm taking care of adolescents, recommends as first line what are called long-acting reversible contraceptives. And that includes the IUD, the intrauterine device, of which there are 5 on the market, and the contraceptive implant, of which there's one called the Nexplanon. So those are, and the reason, so the other important point is there is no one perfect method. So when patients come in or their parents come in with them and say, well, what is the best? What do you recommend? And I say, well, I think we really need to dive a little bit deeper in what's important. In medicine, we often think of what is most effective as what is best, and that's why we really like these long-acting reversible methods. But it's not for everyone to have something in their body like an IUD or an implant. It's not for someone to take a pill every day, or wear a patch, or have a vaginal ring in, or get a shot. But you need to do something, and normally that involves either one of these methods or putting on a barrier like a condom. So that's normally the way I started, is asking about what they know and what's important to them.
It's a great way to start the conversation. Do you feel like, in your mind, let's say you meet somebody who's coming in, they're sexually active, do you, and you're not sure, I mean, I think the hard part about teenagers is that the pill is so common, but it's really hard realistically to trust that a teenager is going to take a pill every single day and not skip. Um, do you do you have a favorite method? All things being equal, and
Um,
why?
yeah, so I do if it's not if it's something that is a patient's willing to try. I like these long acting reversible methods. So either again the implant which goes in the arm, it's about the size of a matchstick, and it lasts for the FDA says 3 years, but it really probably lasts more like 5 years. So it lasts for years at a time. And what's really nice and what often adolescents are okay with this too is it doesn't require a pelvic exam. And the other side of the long-acting reversibles are the IUDs. So does require a pelvic exam, and it goes in with a procedure that's pretty similar to a Pap smear. If people think about it like that, it requires a speculum exam. But those also last for years at a time, and then exactly like you're saying, once it's placed, doesn't require the the patient or the family to remember to do anything. You don't have to pick up a prescription every week or month, take a pill, put on a patch once a week, or put in a vaginal ring, or get an injection once every 3 months, which is what all the other hormonal methods require.
This is so interesting because I feel that Nexplanon, the way you describe it, it sounds like a wonderful option to not need to have a pelvic exam. Um, is the procedure fairly simple? I mean, can you explain a little bit more what that would look like for a patient?
Sure. So outpatient procedure, come in, we talk about it, they sign a consent, and then it's a small numbing shot with typically lidocaine, and then that feels like a bee sting, and then the rest is just a little bit of pressure. Takes about a minute. Put a bandage on them, and then it goes in the arm between the elbow and the shoulder on the inside, and they should be able to feel it, but it shouldn't be visual. If you're out in a bathing suit or anything else, it's not like people should be able to tell that it's there. But the user, the patient can feel their arm and feel that it's there. And that's for all those reasons. It's actually why of the most people in the United States who use one of these long-acting methods that's reversible, the LARCs, use an IUD, but amongst adolescents, it's much more common to use this Nexplanon.
And if a teenager pushed hard enough, could they take it out? I mean, what are the harms that you see from it?
Sure. So as long as they keep the bandage on for that one day, it's very unlikely to come out. You have to break the skin back open. So that's good that it won't happen unintentionally or just if you bang your arm. But that is one drawback is that you need typically a healthcare provider to remove it. So that it for some is a barrier. But really the biggest issue is that it can cause irregular bleeding. So
Okay.
it's just hard to predict what it's going to do. For some patients, they won't have any more bleeding, and that's totally safe, but you can't predict it. Others will have less bleeding, but sometimes you'll also have spotting throughout the cycle. And that's the reason that often adolescents get frustrated with it. They don't like the uncontrolled bleeding, possibly having some spotting.
Like a,
That's the main drawback.
okay. And weight gain, does that happen with the Nexplanon?
Nope. Weight gain has never been associated with any birth control method except the Depo Provera, which is an injectable contraception. So it comes as basically a shot, an intramuscular injection that patients get every 3 months. That's the only one. For some, doesn't cause weight gain at all, but it has been linked to weight gain in studies.
Okay, so I think so. As far as this, to sum up the Nexplanon, it's a good outpatient procedure, fairly simple. It doesn't require a pelvic exam. You can leave it in for a few years, and the main drawback is menstrual irregularity.
That's exactly right.
Okay, so since you brought up the Depo-Provera shot and the side effects, can we talk about that a little bit more? Is that something that people can go to their OBGYN for? Can the shot be given at the pharmacy? Like, how does somebody get the Depo-Provera shot, and what does that look like?
So it differs a little bit by region, and there was a recent move to be able to do it to send it home, and if you felt comfortable doing a sub-Q injection, you can do it, but that's very hard. Most people aren't typically doing it at home. So it does require a trip to a healthcare facility, and these can be your local health departments, federally qualified health centers, primary care, pediatrician offices. Just as long as they offer it, it can be done and is often done there. But you do need to come back every 3 months. And for
Okay.
some patients, really, they like it. It's, again, it is somewhere in between the long acting, like it doesn't last for years, but also doesn't require you to do something every day, like take a pill. So it's in between. The other downside of that is every other method, it's either in your body or you're taking a pill, and then as soon as you stop, you can get pregnant. Depo, sometimes the Depo Provera will hang in your body for longer than you can only rely on it for 3 months, but sometimes afterwards, if you're actually trying to get pregnant, it can prevent you from getting pregnant for up to a year or slightly longer. So it doesn't have that
That's a good thing
easy
to know.
on off switch.
That's really interesting. I find if I bring that one up, as soon as I say there's a potential side effect of weight gain, the conversation tends to end.
Yeah, yeah.
I don't,
And again, that's not for everyone, but it's
correct.
we see it in studies enough to know that it certainly it does happen.
And it's only like 3 to 5 pounds, right? It's not a ton of weight.
It's not a ton of weight, but obviously individual results do vary, and unfortunately, I have had some patients who have gained more than that, but many who rely on it for years and have never had any weight gain. So you just don't know until you try it.
Interesting.
And so, right, so the Nexplanon and the Depo are the two that go in the arm. And then just to round out our conversation about the long-acting reversible contraceptions, which, I really like, and I feel like it's, like you said, everyone knows about pills. I don't think everyone knows about these IUDs. So there's 5 on the market. 4 out of the 5 have hormones in them. And I would recommend it with hormones unless it's got a very low dose. And I explain it in a similar way now. If you take asthma medicines, if you have an asthma attack, you take an inhaler. That way the medicine goes mainly to the lungs and doesn't have to go all through the body like if you were to take a pill, like a pill of a steroid. And so by the same token, the IUDs, it's got a tiny amount of medicine that's in it's in the actual structure of the IUD, and it's really releasing a small amount just into the uterus. So most of the time there aren't a lot of systemic side effects. There aren't a lot of headaches or fatigue or changes in any of the other bodily systems. It's really just impacting the uterus, and typically it's reducing periods and menstrual blood flow to either completely eliminating it or making it much lighter, and that's totally safe, and most patients really enjoy that.
And how long can they keep the IUD in?
Depending on the type, 3 to 5 years, and the one without hormones can be up to 10 years. You don't have to think about it. You don't have to get prescriptions or go to the pharmacy or remember to do anything. It's just in your body and working. It's what we call it's forgettable.
And Matt, correct me if I'm wrong, but it's a very popular birth control method in Asia, correct? I know it's much more I've read that it's much more popular there than it is in the United States, which is interesting to me.
Exactly. There are regions in the world where it is ubiquitous, where everyone's using it. Here, pills seem to be very popular, and actually for women that are in their late 20s and through 30s and 40s, sterilization is really popular here. But China has, I think, 50 types of IUDs. I mean, there's the market is filled with them, so lots of different options throughout the world.
Another common misconception is that for IUD placements, they should be done after women have had babies already. Tell us about this. Like, what age do you recommend IUD placement? Is there an age that's too young?
Certainly, you want to wait until after periods begin. But there really isn't, as long as once someone is having regular periods, then you can, then they can absolutely have an IUD placed. There is no age that's too early.
So if a teenager is sexually active, they can use an IUD as their first method of birth control.
Absolutely.
Safely.
Yep. Absolutely. And that's why American Academy of Pediatrics, they say IUDs are first line. They should be offered to adolescents along with everything else.
Now, and quickly, you mentioned the non-hormonal type of IUD. Why should a patient think about one versus the other? Are there reasons why somebody shouldn't want the hormones?
And so ultimately, what I found is are a few patients, especially coming from certain cultures or certain personal preference, where if it's really important to have a regular period every month, then you want the one without hormones. But barring that, I think most people like the quote unquote side effect or the secondary effect of the hormonal ones, which is either reduced menstruation or reduced blood loss during a period or no blood loss at all. Like you go years without having a period. And again, that's totally safe.
So just to kind of sum it up, so the hormonal IUDs, you can leave them in for about 5 years. And the side effect is that you might have an absence of your period or lightened periods. And then the non-hormonal, you can leave it up to 10 years and you'll still get your regular menstrual flow.
That's right. It won't change the frequency of your periods. You'll still have them every month. That's exactly it.
And what about the procedure of placing them? What should somebody expect? Is it expected to be uncomfortable? Is it simple? What does it look like?
Right. So, I mean, it does require a pelvic exam, placing a speculum, and you have a wide array of patients that you take care of. Not all 15, 17, 19-year-olds will be able to tolerate that, but it should only take about a minute. Some minor cramping, and all that we recommend is to take ibuprofen or an Aleve, either just before or after to help with that cramping. As I said, there is no one perfect birth control method. It's about what the patient wants, what the patient's needs are, what their expectations, what they can handle. And so I wish that these methods that are the most effective at preventing pregnancy didn't require anything to get them in, but unfortunately you got to find a way to get them in the body, and that can be challenging for some, but most get through it very easily.
And it sounds so nice to then not have to worry about it for so many years.
Right. Set it and forget it.
It's a big plus. Set it and forget it. I like that.
And it will, it is also just worth saying here, and probably an important point to wrap up on is these methods, everything that we're talking about in terms of the effectiveness for preventing pregnancy, they work really well, but they don't protect against sexually transmitted infection spreading. So you have this in place typically to help prevent a pregnancy, and especially it's great if you have a monogamous partner and you've been tested, you both have been tested before the couple gets together to make sure they don't have diseases. But if you are having multiple partners or aren't sure about your partner's fidelity, then you should also be using a barrier method, typically a condom, to prevent sexually transmitted infection spreading.
Absolutely. Double cover, right?
That's right. Yeah.
And going back to birth control pills, I know a lot of us that are listening are familiar with birth control pills. Are there anything we should think about in terms of what type to pick? A lot of people have questions about, they want the low hormone birth controls. Why should one think about, and I think people think when they hear low, that low means better. Mm-hmm. So can you explain the difference between the two and why someone might want one versus the other?
Yeah, so there's so many birth control. I think there's over 50 formulations that you can get, and so what I typically start with is a monophasic, and that's a fancy word for just meaning the amount of estrogen and progesterone is the same throughout the cycle. Sometimes there's also triphasic, but so monophasic, and that most of the ones with low have low in the name, and I tend to avoid the ones with lowest estrogen because they can produce breakthrough bleeding, which I think can be a nuisance, and I think especially for adolescents are a little bit more sensitive to that. I typically just middle of the road monophasic pill, and I think ultimately the best thing to do is to go in and speak to your provider and just go ahead and try something, and make sure it's covered, by your health insurance plan, affordable. There's a few that are on a Walmart $9 list if insurance coverage is difficult, and just choose one of those and just try it out. And if it doesn't work, go for a second one. It's a little hard to predict how people are going to respond, but in general, they all work well. And I would avoid the very lowest estrogen formulation. Most people don't have any significant side effect from any type of pill. But when you get
Yes.
something, I would say just try something, modulate either the progesterone that you're using or the amount of estrogen that's in there, and hopefully you'll get a reduction in whatever's bothering you. Or switch to another
That makes sense.
formulation. Yeah, the patch and the vaginal ring, those typically give you more of a steady state of the hormones, and so that's sometimes it's the change. You take it every day, and so you get a lot as it's first being digested, and then it trails off over the next 20 hours. So the patch is it's on for once change it every week, and it stays on the skin, but it gives you a pretty smooth level, as does the vaginal ring.
I find those to be not as popular. Do you find that as well?
I think most people end up starting with
Mhm.
the pill and then deciding to change it up if it didn't work for them. They're having a tough time taking the pill, they're forgetting a lot, or they're having one of these side effects. So I think that's right.
That
It's
makes
not
sense.
normally the first, but there's no reason why you can't. They're great methods if they work for you.
And in terms of the vaginal ring, does that method work very well in terms of the ring staying in place? I
Most,
think that's
yeah,
what a lot of parents worry about, that how can you trust it's
yeah.
going to stay there?
I think a lot of people, parents and patients worry, am I going to feel it? Is it going to get in the way of sex? Is it, but it really, once you place it in the vagina, it normally just stays there. I think the hard part about adolescence is feeling self-conscious during sex, wanting to take it out. And the more times you take it out, less likely you're going to remember to put it back in. And then once you have that absence of it in place is when you're at risk of unintended pregnancy.
Okay, and that's what we're trying to
Trying to
avoid.
avoid, that's right.
Any other points about the birth control pill that I forgot to mention or ask about?
No, I think, there's all kinds of apps and ways to help people remember to take a pill every day, change a patch, change a ring. But I think ultimately there's good pill takers, people who reliably do that. I think probably if you're going to be a good pill taker as an adult, you're probably a good pill taker as an adolescent, or vice versa. So it's worth it to try and use some of these apps and things that can alarms that, but it's just ultimately not going to work for everyone, and so some of this is a little bit of trial and error.
Now, what about a teenager that forgets to take the pill for a day or 2 days? When is there a risk of pregnancy truly increased?
If it's just a day, you can double up. 2 days, you can again double it up the next day. But once you start getting to that, missing it 3 days in a row, you've really given your body a long window without the hormones that are going to try and regulate and prevent pregnancy. So you should be using some backup methods. And I think that also then tails nicely into the topic of emergency contraception, which is its own long topic, but just for people to be aware of, we've got four great options for emergency contraception. So if your birth control method fails, whether that's a condom breaking or missing three pills, you can do things, and several of them are over the counter and don't require a prescription. You got Ella and Plan B. If you're taking birth controls, you can Google and see whether or not some birth controls you can take several in a row on the same day, and that can act as emergency contraception. And then also the non-hormonal IUD, which we were talking about before, is very effective as emergency contraception. And all of those can be done in the 5 days following, up to 5 days following the unprotected or the intercourse that's placing them at risk. So
Okay,
it's just
wow.
important for everyone to be aware of that there's lots of options out there.
What about, there's a myth that goes around that if women take the birth control pill, it might affect their fertility in the future. Can you comment on that at all? Is
I
that
can.
true?
Yeah, no, so there's no truth to any of these methods causing any impact in fertility. The only thing, as I mentioned once, the Depo sometimes will stay in your body longer than you want, but as soon as it leaves, you will return to your fertility, and that's true for birth control pills. Do not influence any future fertility. Neither do the IUDs, the Nexplanon, the pill, patch, or ring. It's all temporary. Once it leaves your body, you will return to your normal fertility.
Yeah, my OB explained it that the reason why you really have to take it every day is because literally after 24 hours it leaves your system, and that's how fleeting the effects are. So it's not going to have any long-lasting effect in terms of fertility. It just, after that 24 hours, it's out of your system.
That's exactly it.
All right. Any other birth control methods that we didn't talk about that you think we should bring up? I heard rumblings about a male type of contraceptive. Is that true? Is that ever going to happen?
There's lots of research on that, and what I'll say for this conversation, it's hard enough to get an adolescent female to take a pill every day. If you want to trust the adolescent male to do something on a regular basis, that's on you. I was an adolescent male once, and I don't think that's what we want to be relying on. I think it's just important to, it's not uncommon for adolescents, teenagers to think that pulling out will work, but we know that there's semen and pre-ejaculate, and it's particularly often hard for, for the male partner to control when they're going to release, and so that's never been shown to be effective. And the rhythm method also requires quite a lot of knowledge of the cycle. And especially adolescence. As the period is being established, it's notoriously irregular. So there's all kinds of challenges to being able to do that effectively, and it really places adolescents at risk. So you want to be using, condoms or barrier methods at the very least, and then one of these other methods that we've talked about to really help prevent pregnancy.
And of course, our favorite's always abstinence, but as you said, 40% of teenagers are having intercourse anyways. I'm just thinking as I start to have you have a teenager.
I have a teenager. Yeah. And I mean, abstinence is the only thing that will guarantee prevention
Right.
against pregnancy, but it's often unrealistic. And I think we don't do our teenagers a service if we don't educate them well.
Right. I agree with you. So now what about from the parent's perspective, if a teenager wants to start a birth control pill, do they have to tell parents? What are the rules around sharing information? I mean, from my personal perspective, I always encourage teenagers to talk to their parents. I don't like when there's information that's not being shared, especially, I feel like it's just better when everybody is aware of what's happening and there's no secrets. But I guess legally, what are parents allowed to know about their teenagers?
Right. So I think that so things do vary state by state. So we can't make any blanket statements about what every parent or adolescent can and can't do across the United States. But most states allow for adolescents to make decisions about for contraception on their own and without their parents being aware. And I think in your intro to that question, I think it's very important for there to be good communication, but that's not always possible. We know not always, the family dynamics are not always supportive, and sometimes there's a guardian, and there's different families, aren't always simple, and you can't always have that good communication. So certainly opening it up in the visit to allow for a good communication between the guardian, the parent, and the adolescent, but ultimately creating a private space for the adolescent to speak with their provider and make their own decisions. So you just want to make sure you address that within your practice, let them know the limits of what you can do. And that's why it's good to know about, again, there's a $9 a month pill on the Walmart, $4, but it's technically $9. So that's a pretty reasonable amount that a teenager should be able to pay if they're putting this in their own, paying for it out of their own pocket.
So is there any other thoughts that you have that we should share to any families listening about birth control that we haven't covered yet?
Yeah, I'll go back to the principles of just, be aware that even if you don't think it could be my teenager, that they're thinking about it. They're likely going to or thinking about experimenting, so to have the conversation. And if you really don't feel like you can, then at least drive them and sit in the parking lot and have them go and visit a provider who will discuss it with them, and just make sure that the challenges of an unintended pregnancy or sexually transmitted infection are very real. And so I still remember I had a really good friend in high school, and he was one of 4 boys, and in there was a big bucket of condoms that the mom would fill up and there was no questions asked. And even as friends, we were told, "Hey, this is where this is. You can go grab it." And I think that attitude, kids are gonna experiment with sex, and if you don't make it easy for them to be careful, then the consequences of unintended pregnancies and infections are going to occur. And so we should make it easy for them to talk about it and make access to these methods as easy as possible.
And I think about it a lot because on one hand, I don't want to be permissive, but on the other hand, you have to be realistic. You don't want to have your head in the sand and then have a problem, or have something happen that we weren't expecting.
That's right, and I think we know from these studies that kids are going to have sex, and so the permissive. I think that's why you have the conversation. Really make sure, hey, I don't want you to have sex until you're ready, until you can talk about it, until you're in a safe relationship. But if you do, here's what you need to know, and here's how to keep yourself safe.
My kids will be 29 and married, right?
That's what we all, right? We
Right?
all think we can control it, but just think back to yourself as an adolescent, and it's they're going through the same things we did.
Absolutely. Thank you so much, Matt Zerden. You're my hero. And if people ever have questions about this, is there any resources they can go to or anything you recommend?
There's a great website, bedsider.org, and I have no affiliation with it, but it's just a great resource. It's designed for adolescents and those in their 20s. It's kind of edgy, but it's all research-based, very informative, and is a great resource. So bedsider.org is a great go-to source.
I'll make sure and link it below.
Awesome.
Thank you so much.
Yeah, sure. This was fun. Take care, Jess. Thanks for doing this.